Okay, thank you, Anitra. And I'm Irish, I've got a strong accent, and I'm quietly spoken, so if at any stage you can't hear me, just stick your hand up and I will move closer to the microphone. So I'm Hugh McGuire. I work at NICE, as stated. I've got 15 years experience of developing guidelines of every different type possible for NICE, and before that I had 12 years working with Cochrane. So I've got a good background in evidence-based medicine. I'd like to start with some thanks to the organisers for the kind invitation to come here. My colleagues in the HIO and the Secretariat, you all for taking the time to come along today, and also I'd like to thank Eleni for looking after the logistics and making sure that everything worked okay for this trip. So, you probably know what NICE does, but what NICE does is we work with the NHS to make sure that our guidance is useful and usable by all involved. We focus on what is most important to the healthcare system and practitioners and patients, and we do that by producing guidance, be it a clinical guideline, public health guideline, health technology assessment, in a way that's very, very transparent but rigorous and strongly evidence-based. And we do that with also supporting implementation through many different channels at NICE. We've got a lot of principles that we have. We've got 13 in total. And I've just put some on the screen, and the highlighted bits are where it fits into the conference theme here. So you can see the conference theme was perspective of citizens regarding the priorities of the health sector. That's two nice principles just there, straight away. You've also got making recommendations based on assessment of population benefits and values. Some of the key things that this conference was going to be discussing. Among other principles, it was how to bring in innovation was a key part of this conference theme. Also sort of looking at efficiency and reducing health inequalities, and the final one, digital transformation. So you can see there's a lot of overlap between what the NICE principles are that have been in place for quite a while and what the efforts going on in Greece are. And then we've got other social values, and NICE has got a remit to make sure that no one is disadvantaged by our recommendations. And since the pandemic, we've stepped up those efforts to make sure that sort of everyone has got increased equity and access of care. And that's based on protected characteristics, but also sort of social demographic factors as well. However, as was noted earlier by Angela, everything's changing. It's changing the whole world over because of the pandemic. The system in England is under a huge amount of pressures. After the pandemic, you can see it as a sort of silver lining of the pandemic, is that the general population is now more aware of evidence in medicine. They're more aware of statistics. They're more aware of that information flow. So there are questionings. And NICE has produced a guidance on how healthcare professionals can include the patients or the users of the service in the decision making. We've had a huge growth in innovation. So we saw the NHS app earlier. Started off with the pandemic, people are now using it the whole time, making appointments, repeat prescriptions, the whole lot. And we've got incredible amounts of data. And again, we've heard that earlier, the data is everywhere. And how can people make decisions about the best choice of care for patients and try to take account of all this data? So we have to change how we do things. And so we've changed it to go to make our processes more streamlined. So a full guideline at NICE will take 2.5 years to develop. Now we react quicker. We do things a lot quicker. We went from 2.5 years for a guideline to producing recommendations for COVID in 3 weeks. So there's a huge change in how we do the things. We're now looking to introduce digital technologies earlier into the system. So if something is promising by way of a digital app, we will work with industry to make sure that that gets introduced into the system and data is collected to show how effective it is in the real world. And it will be available for 3 years, and then the companies will have to show how effective it is. As I said, health inequalities really came to the fore in terms of problems for the healthcare system, access to care being a primary one. And also the NHS long-term plan is really focusing on prevention. So we're doing our best to make sure that we can get information out there. So the first 2 digital apps that we put through the system were around common mental disorders in children and adults and weight management apps. So we're working with the NHS to improve productivity and get recommendations that will help the NHS save time and help patients get quicker access to care as soon as possible. So with all of this going on, part of what the team that I work in is a team of 4 people out of nearly 700 who work at NICE. It's our role to share our knowledge and experiences with other countries and other organisations looking to improve health for their countries' populations. And we do that, for example, as with the HIO in Cyprus, by going in and working with them to identify the best way that they can use guidelines or any other products, such as quality indicators, to improve the healthcare of the population in Cyprus. It's not going in and doing what NICE does, because what works at NICE in England is not going to work in other countries, but it's finding out what are the right methods to do, setting ground rules for what is best practice internationally, and then working with that. So this is where our journey started. It was my first trip after the pandemic, and it was that awareness-raising event with stakeholders in Nicosia. And it was quite an important one because, as Monica mentioned, getting engagement and buy-in and support from stakeholders in Cyprus was looking like it was going to be a challenge. So one of the best ways of doing that is have a forum where people can share their concerns. They can challenge you about what it is you're planning to do, because once you know that, then you can find a solution. It's all about finding a way forward. So over the last 2.5 years, we've been engaging on several things, and we've been doing some quite good work to support them. We're quite happy with how it's going. They are our star pupils in one sense, and we are getting a lot of learning from them as well. So what is it that we've got from this engagement? We've got validation that what we do is good. It's always reassuring to know that other people can use your guidance, the work that you've put time and effort and money into producing, and then find that other people can use it. That's great. It's given us an opportunity to learn. So the idea that NICE is a world-leading institution is good, but we have to carry on learning. So an example of this is the HIO and Secretariat using a committee, the same committee, to contextualize a guideline and to derive quality indicators at the same time. At NICE, we developed the guideline first, and then we have a separate committee who look at the quality indicators. Cyprus has shown us that you can do both at the same time. You can imagine the efficiencies related to that. And it's also provided us with an opportunity to engage with other people and learn from them as well. So we recently did a workshop at the Guidelines International Network conference in Glasgow with the HIO and with partners in India. And you can think about Cyprus, a small country, unified healthcare system. India is not a small country and it doesn't have a unified healthcare system. But there's a lot of common challenges in both places around introducing guidelines and indicators. And it was a good opportunity to get that discussion going. So we found it very, very useful. However, how do we get to this point? You have to have mutual respect for whoever you're working with. And that starts off with, for me, the HIO starting off, what do healthcare professionals, what are their concerns, what do they want to do? What do the patient organizations want to do? It's by listening and respecting their points of view. It's the same with the HIO, Secretariat and NICE. We have to respect what it is that we do. You have to be clear about the challenge. You need good communication. We've heard that earlier as well. Georgios in the Secretariat is brilliant at communicating with our team in terms of, we will send you the documents for review on this date, and lo and behold, they will arrive on that date. If there's any chance of a delay, we'll get advance warning. So this is very, very useful to us to allow us to plan our work. And you have to be flexible. Timelines can change. They will change. That's human nature. But you have to be flexible about what the methods are. If someone tells me you cannot recruit committee members the same in Cyprus as you do in England, where it's an open recruitment, we cannot just say, no, you have to carry on doing it that way. You have to be adaptable to and flexible to what the situation is in front of you and give the best advice you can on that. And with that, I'll just say thank you to you all. Thank you.